If you've ever had something stuck in your eye and you haven't been able to find it or get it out, this might help you to get it out of there. This patient came in complaining that their eye felt like there was something in it, but they couldn't get anything out. They've been messing with it for a couple days. They noticed that if they looked down, it didn't hurt. When they closed their eyes, it did hurt, and they could kind of sense where it was. So this person was pretty miserable. By the time they came to me, they just had been putting drops in, doing eye wash, and trying to make it so whatever was in there would get out. I looked at them. I could tell there were little scratches towards the upper part of the cornea. We can put this little yellow dye in there, and it'll highlight the areas where there's scratches. And so we can see these little indents where something's been scratching the eye. So I had them look down and flip the upper lid, and you can see here that it's really, really easy at that point just to get that little thing out of there. It was stuck. The eyelid, the upper eyelid, is really good about keeping things off of the eye. A little bulldozer. That's why it's hard to get contacts in for some people. But once something gets under that upper lid, it can be hard to kind of get it out when that lid is pressed up against. So once I flip that lid, I just barely can touch that little foreign body in there and get it out of there. So a little tip for you, if you ever have something that you think is stuck in your eye, if it feels better when you look down, you could flip your upper lid and use some eye wash on the upper lid, and that might just lodge whatever's in there or get that out of there. So what you can do is, if you're comfortable, you can pull your lashes, push down on the eyelid from above and kind of hold those lashes up, kind of have your eyelid flipped. Now, if you were a kid and you did that to scare your friends, then you might be very comfortable with that. If you're not, then just go to your eye doctor and have them do that for you. It'll save you a lot of pain and discomfort. Like this person, they should have come in a lot sooner. If it does have enough time to be in there, it can scratch your cornea. In that case, you probably want a little antibiotic just to make sure you don't get an infection, because that can cause vision loss. So you want to make sure you don't get an infection. So if it's scratched and irritated, then you should go in regardless. But there could be something stuck under your upper lid. So a lot of eye wash, lifting that upper lid up, squirting eye wash kind of up towards the lid could possibly dislodge it too. So there are a few things to keep in mind. It kind of left a lightning bolt, sort of a scratch on their eye, which they didn't think was really cool, but it was. Maybe it was a sign from Harry Potter to us. But anyway, try not to get things in your eye. Maybe the moral of the story. But if you do, a lot of eye wash, lift that upper lid. If you can flip the lid and rinse the upper lid, that would be great. If you can't, or if it really hurts, go in and get your eyes checked. Make sure there's no scratch. If you have any questions, let me know.